As we enter the 6th week of the 2019 Wyoming Legislative Session, we're continuing our series, and today we're joined by Representative Sue Wilson. Looking back to last week, I know one of the big issues was crafting the supplemental budget. How are those negotiations going?
The conference committee were just appointed Friday, so this week was really a process of contemplation for those folks. And so the supplemental budget isn't really that many dollars in comparison to the whole state budget.
Before the end of his term, Governor Mead urged legislators to focus on education. He believed that the practice of taking resources from the general fund to supplement education was not practical. Do you think that legislators are taking his advice to heart?
It's hard to say. Over the last few years, we've cut state agencies a lot. I didn't even realize this until I was in the legislature, that until 10 years ago, our state education system was under the jurisdiction of the state Supreme Court. The decisions of the Supreme Court as far as how we had to fund education are still very much part of the discussion and the challenge now that that designated funding isn't there.
You've been a representative since 2013. What has been the biggest challenge for our state?
Starting about 2015, 2016, that was where we really had the downturn. And I tell you, that has been the biggest change. You know, on average, state agencies, we've cut 15%. Some of them have been cut like 30, 40%. I've had people ask me, when are we going to use the money from the rainy day fund? I'm like, we've been using it. We've used like $400 million. Those are discussions that everybody across the state needs to be educated on and participate in.
How can people become more educated in the issues?
Watch your show.
Well, thank you.
That's right. Access the legislative website and really just try to look at that.
As the chairman of the House Labor, Health and Social Services Committee, you're involved in a proposal which studies Medicaid expansion.
Right. When we were first considering it back in 2012, we had a number of programs that were funded by general funds that we could maybe do away with because of getting the Medicaid money. Unfortunately, with the downturn, those programs have mostly been cut. The question for me now is, if we think it's a good idea to expand Medicaid, where are we going to get the $33 million of biennium from?
Thank you so much for coming on the show and giving us this update.
Absolutely.